Good day, and welcome to the first in a series of Fireside Chats that are hosted by the Bellwether League Foundation. Bellwether League Foundation recognizes innovation and excellence in the practice of healthcare supply chain management with several awards, including the Bellwether, the Future Famer, and the AMER Awards. I'm John Strong, class of 2011 Bellwether, and I'm going to be your host for today's chat. Today, we're talking about exercising your entrepreneurial spirit. And I can't think of two better qualified people to talk about entrepreneurialism in the healthcare supply chain environment. With me is Regine Honoré-Villain, who is the Senior Vice President and Chief Supply Chain and Support Services Officer for Ochsner Health, and Dr. Jimmy Chung, who is the Chief Medical Officer for Advantis Health Partners, and certainly one of the top recognized experts in the field of healthcare value analysis. So welcome to you both. Regine, if you'd like to start by introducing yourself and your organization, that would be terrific.
Thank you, John, for that intro. And I did not realize that this was the first one. So we get to be the inaugural group. So no pressure here, no pressure, Jimmy. You know, I think that means that we have to behave, unfortunately. My name is Regine Villain, and as John mentioned, I am the Chief Supply Chain and Support Services Officer at Ochsner Health. Ochsner Health is the largest not-for-profit health system in the Gulf South. And we currently have about 47, 48 hospitals, depending on the day. You know, that changes a little bit. And we basically are in primarily in Louisiana and in Mississippi, and we have a couple of facilities also in Alabama. But generally, just really happy to be here and honored to be part of this fireside chat.
Great, thank you. Jimmy?
Yeah, thank you. Great to be here, and just really what an honor to be included as part of this this fireside chat. My name is Jimmy Chung. I'm the Chief Medical Officer for Advantis Health Partners. I'm a general surgeon by background, been board certified 25 years, past, I'd say about 10 to 12 years, I've been in administration, primarily in now supply chain and perioperative services. I joined Advantis Health Partners about 3 years ago, as it was being developed, kind of a startup. Where what we are is actually we are the supply chain function, if you will, under Bonsacor Mercy Health that has been commercialized to provide a end-to-end supply chain solutions that is backed by a value-based GPO portfolio to assist other health systems and hospitals and sometimes even non-health systems to get value out of their purchasing power, as well as making sure that we have provided excellent and high quality care for our patients.
Great, thanks very much, Jimmy. We're going to start off with Regine this morning, and Ochsner's been at, I think, several ventures over the last couple of years involving products. Regine, can you talk a little bit about that and how those ventures are going for our audience?
I'm sorry, I missed the question, John. Can you repeat that?
Oh, sure. Over the past couple of years, Ochsner's gotten into a number of supply chain related for-profit ventures, I think. And if you could talk to us a little bit about how those are going, what they are, and sort of give the audience a feel for how that's working for you.
Sure. I think you may be referring to, you know, some of the things that we've done during and post-pandemic. I also want to add that I've been at Ochsner for 5.5 years now. So I basically saw myself growing in leaps and bounds at Ochsner through the pandemic. When the pandemic was declared, you know, basically in Louisiana, I had been at Ochsner less than 1 year. And so still trying to get my bearings around a little bit, because it's a fairly large organization. and I, basically stepped into high gear with the pandemic. And so while we were going through the pandemic, not unlike many of us in the industry, we had to contend with all of those issues that you know of, in terms of the unreliability of the sources. We were flooded with requests and offers from folks that we had never heard before, around PPE and making sure that we were able to have what we had. And we were surging. Louisiana was surging at the same time that New York was. New York, I believe, was a week or two ahead of us. And so we were basically competing for resources with what was going on in New York. And so it became very, very, very testy. And from day one, what we set out with the supply chain at Auctioner is that we would make sure to do everything in our power to not be without and to not find ourselves in a situation where we could not take care of our patients. And so through the course of all the disruptions that we experienced, one of the first things that we did was to move away from where everybody was going. So everybody was going to China for their sourcing. We started to source a little bit closer to home. We were going to Mexico, we were going to Brazil to source items. And then in a very fortuitous conversation with our CEO and the senior team member, we started to talk about the dependency that we had on getting those PPEs and decided that, you know what, why not just do our own? Why not make our own PPE? Why not try to figure out how to get a hold of our destiny and control that destiny? And so with that was born the idea. And of course, everybody thought this was a crazy one, unheard of. But this, out of that was born the idea of us joining forces with a manufacturing entity to create an actual PPE venture. And so we decided at the beginning that we were not going to be, the answer for everything, but at least for your basic PPEs, the things that everybody was clamoring about. And so it was your masks, your respirators, your gloves, your protective gowns, your bouffant caps, your shoe covers, etc. And so we agreed that we were going to start there. And that's exactly what we did. And we broke ground basically from nothing. And in less than a year, we had a manufacturing entity with the gloves. So we started the venture with the gloves, different size gloves, different thickness, et cetera, because we felt like the market was really, really, really ready for that. And at the same time, we also went ahead and did with that partner, we also created the masks and some of the woven SMS products. So for us, it was really an opportunity to further integrate and vertically integrate really our supply chain organization. Because you think about it, it's about having control of everything from your raw material all the way to the finished product at the bedside. And so we pushed the conversation to even going to the raw material at the SMS plant, where we actually started manufacturing the SMS as well, the woven material, instead of procuring it from China. And so this venture, now I'll caveat to say that what happened in the meantime, the pandemic subsided. I'm doing the air quote here. And so everybody and all of the sentiments about bringing everything to America and bringing everything at least near shore, all of those sentiments started to go away a little bit from the provider community, because people started to feel comfortable again about being able to go back and get their products for literally, pennies on the dollar. And so it has been quite challenging to try to meet the market where it is in terms of pricing, because obviously when it comes to the competition with China and the likes of China, it's very easy to bring the products in here at probably the very bottom And so we've been adjusting and readjusting when it comes to that, and also have been lobbying with the government to really continue to push for their subsidies. That's something that was promised to us during the pandemic. It's been a little bit slow to come, but we are still working through that, and it looks like we're going to be able to get some headways there.
That's great. It sounds like this was a venture sort of born out of need for the product to begin with. I'm assuming, though, that there's an expectation by your business partner and probably by senior management at your healthcare system that there's profit involved as well. Is that true?
That is correct. Absolutely. I mean, profit is always the name of the game. But frankly, to your point, when this started, this really started with us being able to take care of our caregivers, and take care of, our patients, because we saw what was going on. Because when this thing started spreading, because we were, again, part of the earlier folks that went through COVID. And once we started to see the ravaging effects of what was going on and what hospitals were going through, what some of my colleagues were going through, then it's like, you know what, anything we can do to secure this and make sure that we can get our hands reliably on the things that we need in order to allow for our caregivers to take care of the patients, and for us to make sure that we are doing everything we can. That was really the first thing. And of course, right after that, profit was, the other part of the conversation, for sure.
Okay, great. Jimmy, you folks took a little different tact and went into services, I believe. Can you tell us a little bit about Advantis and some of the key things that you're working on at Advantis right now?
Yeah, absolutely. So, the key element in what we're trying to develop is that we realize that there is a tremendous amount of waste and opportunity in the way hospitals and health systems are purchasing and procuring and utilizing products and services, and that our current economic environment is such that basically most hospitals purchase through a large GPO. And over the last decade or so, 3 large GPOs have kind of emerged as the dominating players in the market through acquisitions and so forth. And we felt that having been through some of the issues ourselves as Bon Secours Mercy Health with one of the GPOs, that there certainly is room in the market for improvement. Specifically, when Bon Secours and Mercy merged in, I'd say about 5 or 6 years ago, they brought their supply chain departments together and had a specific goal to meet. And when they performed way beyond the expected goal, they realized that there was something special here, something that was worth growing and expanding into a commercializable business, which would be aligned with some of the other businesses that Bon Secours Mercy had launched in revenue cycle and patient transfer and so forth. And so this would have been the 4th business that came out of Bon Secours Mercy Health. And the idea behind this is that we feel that the current GPO businesses have slowly lost the ability to provide value to both the suppliers and the providers, and seeing that when you have a GPO that pretty much puts every supplier and product on the shelves, it creates a scenario where the suppliers really no longer have any advantage, and from the provider side, it creates a scenario where you're not really you still have to do all of the shopping and vetting yourself to ensure that you're getting high quality products. So we've decided to adopt a more value-based approach where we are creating a clinically vetted, value-based portfolio, narrow portfolio of contracts that we start from what we think the patients will need for certain procedures or the care that the hospitals will need, the products that the hospitals will need to care for their patients. And then we go from there to find out who are the best suppliers in the market who are willing to partner with us on this journey. Which of the businesses and suppliers are more interested in a long-term approach as opposed to just selling product in a transactional relationship. And we've been identifying who those suppliers are and putting them on our portfolio. That way, the suppliers gain more value because they become highlighted as the preferred partner for our GPO, and the providers gain value because they don't have to do a lot of the work themselves to get quality data to make sure that their products are going to be what their patients need and will provide good care for their patients. So we're basically outsourcing, or we're becoming the outsource for supply chain operations, value analysis, and a standalone GPO that health systems can rely on to ensure that end-to-end supply chain not just function, but also as a strategic entity for their systems and hospitals. And this is really something that we want to emphasize, that it's based on what we feel is best for the patient and aligned with the future of value-based care payment models that I know that most hospitals are going to have to adopt at some point soon. So
yeah. That's good. That's very helpful. I've said for years, I developed some for-profit businesses years ago in my career, and I've said that some of this is not for the faint of heart. Is that true? Do you agree with that?
Well, I think in a way, yes, but I think the other way to think about it is if you know what's coming, if you know that there's a tsunami coming, if you know there's a hurricane coming, you have to act to be able to not just survive, but thrive in that environment. And we know that healthcare currently is not sustainable the way it is.
Right. Right.
Not just from a cost perspective, but from also a patient safety perspective. And so if you know that that's coming, or that is already here, and that's the burning platform that we have to all align on, then not acting and not taking risks is probably riskier. And so I think it's not so much that it's not for the faint of heart, but it's more that you have to, when you realize that what needs to be done is right in front of you, then you realize that this is not as risky as you think. Sometimes, and probably the biggest lesson I learned is that sometimes risk is not as risky as you think.
Okay, good. Regine, with your products, have you had success in selling to healthcare systems and hospitals and others outside Ochsner?
Well, yeah, the premise of doing this was never to be just for Ochsner. We were thinking, again, for the industry, just to align myself with what Jimmy is saying. Once the need became clear, because during that time, the networking amongst the supply chain leaders across the country was like absolutely bar none, the closest and the most integrated it's ever been. It was actually truly, it felt like a community. And so it became very clear very quickly that we're all going through the same challenges, the same issues, some a little bit worse than others, but generally we're going through the same issues. And so when we set out to solution for the industry, the idea was to do it not only for Ochsner, but for others. And so obviously auctioneer being, customer one, that was certainly the premise of it. But we partnered because part of that was also partnering with others in order to create a greater impact in the industry. So I was smiling because Jimmy is talking about the GPO. We partnered with our GPO to help us, introduce the portfolio of those gloves and the products in order to help us, make greater impact in the market. So, and also, we participated in quite a few trade shows and reached out to folks. So we got on contract for a few of those organizations, and, are working through the distribution channels to make sure that we can get those products, reliably to them as well. But we do have others outside that are using the products. And part of the vision was also to not only sell in healthcare, but also potentially outside healthcare, because everybody has PPE need, especially when you think about gloves, you think about all the industries that use gloves. And so that's the idea of really opening this and creating a true nearshoring and domestic manufacturing entity.
You alluded to the nearshoring movement that came about as a result of the pandemic. And I don't want to put words in your mouth here, but it sounds like price for many buyers is still king, and that people have short memories in terms of what they went through when they were trying to get PPE the last time. Can you comment a little bit more on that? I'm sure that's very frustrating to you because it does cost more in this country. It just does.
That's correct.
How are you trying to work through that?
So yes, you're not putting words in my mouth, because that's exactly what I said or what I alluded to. There was the sentiment throughout the pandemic while things were still really happening. You probably heard from everybody you talked to that we need to work on making sure that we bring domestic manufacturing. We need to make sure that onshoring is something that we're doing in order to reduce the reliance on others outside of the United States. Well, that was great while the pandemic was going on. But the minute things started to subside and there was a semblance of normalcy that came back, the market was really flooded with products from, Southeast Asia, and the prices, started to really tumble. Now, granted, during the pandemic, the pricing that we were seeing for some of those products, the PPEs, was absolutely insane, out of this world, unsustainable, no question. And certainly when we built out our financial model, we took into account that this was not going to be a sustainable price. And we built it at what we thought was the pre-pandemic price, and, at least to make sure to sustain profit. But very quickly, things went well beyond and below pre-pandemic pricing, at pricing that we've probably never seen before or haven't seen in a long, 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 long time. And so it was like, wow. So you had that, you were contending with the market being flooded with products from Southeast Asia. And then, of course, everybody's attention shifted away from the idea of creating a more resilient and reliable supply chain, by at least diverting your and sourcing your products a little bit differently, to just looking at pricing. I mean, people literally started saying it really doesn't matter. If I can pay X amount for my gloves, that's all that matters right now. Also, like I say, I also recognize that following, the pandemic, many organizations also went a period where, from a financial point of view, it became very, very questionable as to whether or not any of those institutions would be profitable. I mean, Auctioneer went through a period of uncertainty as well. Thankfully, with the leadership that we have and everything that we've done through the organization, we're able to avoid, anything that would be, negative. But when it comes to organizations, everybody came out of the pandemic saying, oh my gosh, from a financial point of view, we're going to have to save, 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 save. And I think almost everybody had that overall $100 million that we needed to take out overall, from all organizations, with supply chain probably being a third of that. So I can understand that, but the conversations with colleagues and other providers where we're not saying 100%, obviously, because everybody has contracts and things going on with either their GPO or their distributor, et cetera, et cetera. But we're saying, can you see yourself carve out, let's say, between 15 and 20% of your volume to make sure that you're creating a more reliable and assuring that you're going to have a pipeline of product. And so for a while, it was definitely frustrating because the answer was, we hear you, we agree, we understand, and we're also watching the bottom line. And so we're going to go back to the way things were. So much so that now that there's conversation and rumblings about, there's increase in COVID cases in some places, et cetera, the phone is ringing again. And people are trying to understand, hey, can we talk about the glove and the PPE business again? It's just a little bit maddening. I think we're all glutton for punishment.
I think that's very insightful, and it just shows you what happens when the tides turn the other way again, right?
Yeah.
Jimmy, it sounds like you're taking a little different approach in terms of partnership with some of your suppliers, and you're vetting product and then buying it through your group purchasing organization. And I really respect your chops in terms of value analysis. Can you tell us a little bit about how that's working, and whether or not you're always after the rock bottom price, or you're looking for something that, in some cases where value analysis shows that paying a little more may make some sense?
Mm-hmm.
Yeah, absolutely. I think that's the key question here in terms of that struggle and balance between the lowest cost versus quality. I think one of the things that we have to keep reminding ourselves is that just because something is more expensive or has a higher cost doesn't necessarily mean that it's better. And in fact, a lot of times it isn't. And so part of value analysis, of course, is to start with what is the what's the best product, or in many ways we look for high quality, but also what is the most what is acceptable, clinically acceptable, and then how can we get that particular product at the lowest cost. So when we work with suppliers, as you mentioned, of course everybody's interested. They want to be on our portfolio. They want a contract on AHP paper. And we're very excited to work with any vendor or supplier who want to join us in our journey. That said, we're also not going to put 50 contracts for implants on our portfolio. That's what we're trying to get away from. And so while we are continue to keep ourselves open to conversations with new and other suppliers, we've had lots of conversations with multiple suppliers who we feel are going to be able to provide not just quality, but also reliability, resilience through business interruptions, any kind of and assurance that we will be partnering together. In non-healthcare industries, you see partnerships all the time that is openly, out there, like car manufacturers and tire companies, or, airplane manufacturer and engine companies, and so forth. And so, even companies that don't necessarily provide similar products that are partnering together, like, Disney and McDonald's or something like that, right? So we know that in healthcare, there's a lot of opportunity where if we collaborate and truly form a partnership where we can be strategic together grow together and not just worry about, well, they're going to sell us this product and we're going to pay them for it, and that's the end of the transaction. Then I think we can truly align to reduce waste and make healthcare safer together. And so with that as our main talking point, I'd say we have a large number of partners, suppliers who are willing to be partners. And in specific, what that means is that we're going to have a long-term relationship. We're not going to put out an RFP every 3 years for every category in our portfolio, just to see who's going to bite and see who's going to bring the latest and the greatest or give us better deals. We have these relationships that are people to people, our people and their people. We talk, we work together, we're transparent, we share data to make sure that that this partnership is going to be successful into the future. And one example for in the category of MedSurg is our relationship with Medline. And Medline, not just as a distributor, but also as a MedSurg product provider, and having a unique relationship with them where we know that we're going to get top pricing, while at the same time they're going to ensure that we work with them to provide quality products for our patients. And so that kind of relationship, I think, takes a lot of time and effort, a lot of energy to create. But in the long run, that saves us a tremendous amount of time and money and energy, as well as building in the reliability into our system.
That's great. Thank you. We're starting to run out of time, and so I'm going to ask you each if you can, if you had one piece of advice and can describe it for our viewers in a minute or less, what would that be, Jimmy?
Well, I guess there aren't too many doctors doing what I'm doing, so I guess if I had to give advice to any physician who is interested in this field, that one thing that still continues to stick with in my mind is you have to stop thinking of yourself as a doctor who is now a health executive. You have to think of yourself as a healthcare executive who happens to have an MD and happens to have patient care experience, because and that might be a subtle difference, but in a way, one thing that really I guess changed my perspective on healthcare as I was transitioning from a clinician to a healthcare administrator. I often compare that to Neo taking the red pill, right? So if you get my allusion there, it really opens your eyes to the bigger issues, beyond just what we do as physicians to take care of patients. What is bigger picture about healthcare? About not just our individual patients, but our community and our planet, and sustainability and diversity and equity and so forth, and the amount of waste and sustainability for providing access and care for our patients means that our hospitals have to survive. Our health systems have to survive from a financial perspective. And so that means that, the way I looked at being a physician was actually, well, it's fun and it's great. I really love, my time with my patients. But in a way, it's kind of a dead-end job where you're not really growing, because, I love surgery. I was very good at it, and then, but it would have been the same thing that I'm doing for the next 30 years. And so to have that bigger picture, to make a bigger impact, I think that's something that would be maybe very important for physicians to realize as they step out of their clinical role into a more administrative role.
That's great. Thank you, Jimmy. Regine, if you had one piece of advice now that you've been at manufacturing PPE and other products for a few years now, what's that piece of advice?
First, let me acknowledge, Jimmy and his role, and, physicians and surgeons like him who have been entering the arena of supply chain. I just want to say thank you, because, without you, we are limited in our ability to get the conversation past a certain point. And so when you walk into a room with me as a physician, as a surgeon, the conversation changes and the attentions shift. And so I just want to take a moment and say thank you to you, Jimmy, and for others like you who have, been taking a leap of faith entering into supply chain. Appreciate it so much. And as far as, advice, and I think I've said that a little bit before, but I want to really get us, in the supply chain, shifting away the focus and the attention that people have about us just delivering supplies, right? Obviously, the name supply chain implies that we're taking care of supplies, right? But we all know that we're doing so much more than that. We are well poised and well positioned in supply chain to make major impacts in our organizations. And so the way that I've been viewing and selling the supply chain at Auctioneer and in other places, increasingly more so, is really helping people to understand that we are positioned perfectly at the intersection of delivering life-saving medical innovations to our patients and our organizations. So we're not delivering supplies. We are delivering medical innovations. And so I would love for us to really continue to think in that way, because it truly elevates the conversations once you see yourself in that light and not just carrying something from to.
That's really very well said. Very well said. And I believe that. And I think both of you were lucky enough to have C-suite executives behind you that believe that supply chain can make a difference. And it's not just about getting the lowest price and pushing boxes around, but there's real value to be had, just like there is in industry. I think that's very well said. Well, our time is up, and I'd like to thank you both, Regine and Jimmy. Absolutely outstanding comments as always, and your insight into the healthcare supply chain is really first rate. It's very contemporary and it's remarkable. And I want to thank you both today on behalf of all of our viewers for joining me for this panel discussion. Thank you very much.
Well, thank you, John.
Thank you for having me.
And thank you, Jimmy.
Thank you, Regine.